Good evening and welcome to Beyond the Front Page, a show brought to you by QU Community College. It's on Spectrum, Verizon Fios, as well as ARMA, the Auburn Regional Media Access, as well as Win 89.1, the college's radio station. I'm your host, Guy Cosentino. Today is November 16th. It is the day designated as the Great American Smokeout. Last spring, in a conversation we had with one of our guests, I think it was before the show or after the show, we were just talking, it's almost been 60 years since the Surgeon General came out with a report telling us that smoking was bad, and we're still talking about smoking.
Here we go.
And so what we had talked about was doing a show on this. A couple of campaigns have gotten in the way since then. We just got done with the election 2023. So what we've asked is Assemblyman John Lemondes, who represents parts of QU County, to come in to talk about what the New York's role is with smoking and what they can do to fight this. But just as important, we wanted to get a local perspective. And Deborah Pickering, who is just new to her job as the QU County Director of Health Education and Public Information. Congratulations on the new job.
Thank you. Thank you for the invitation.
Had been here many moons ago to talk about public health. So we're going to talk about that. We might get one or two political questions in at the very end. Not for you. They'll be for him.
Thank you.
You're okay on that?
Yes.
And it is just a coincidence that today, when we schedule it, is the Great American Smokeout. Yeah. I do not know how that occurred. So, welcome both of you.
Thank you.
So, for those who don't know, could you just give us a real quick thumbnail? What is the Great American Smokeout? I know it's been around for a while.
It has. We're almost up to our 50th anniversary of the Great American Smokeout. Founded by the American Cancer Society, it's really established as a day to start your tobacco-free journey or set the day to quit.
So what's planned for today? What are you doing locally today as QU County Public Health?
Yeah. We've actually started about 2 weeks ago promoting on social media platforms. We've reached out to our community partners to just spread the word. You know, it cannot just be today. It's great to be here today and promote it, but it has to be a continuation throughout the year.
So you said 50 years?
It's close to 50 years. We're coming up on it in just a couple of years.
Okay, so, well, let's go through some numbers that you know, and maybe someone can jump in here where he thinks. As a percentage of our population, do we know how many people smoke, whether it's in QU County or the state of New York?
We do. In QU County, we have close to 19% of our adult smokers. So about 1 in 5 adults smoke right now.
Are we higher or lower than area counties of the state of New York?
We are about in the middle of the county. If you're looking at the counties, there are some counties down to about 5%, some are about 28%. So we're looking good. However, we'd love the number to be 0, right? In the state, it's at about 12%.
So we're above the state average on that.
Correct.
Do we know, so you said adults, so do we have young people, an age demographic?
We do have some numbers on youth, not specifically in QU County. For the state, we do have those numbers. They're pretty low for cigarette use. It's about 2%. However, we know half of those are using menthol products for cigarettes. The issue that we know for youth is electronic cigarettes, which we'll probably get into.
And is that that's vaping?
Vaping, electronic cigarettes, we use those terms interchangeably. About 18, close to 19% of youth are vaping. And if you talk to school administrators, parents, we think that that's probably underreported.
And do we know anything about gender?
Not specifically at this moment, yeah. There is a local coalition, the QU County Drug-Free Task Force, that's right now doing a local survey to gather specific data in our county on youth and adults. The last specific data that we have that's broken down is about 12 years old.
So one of the things you were able to vote on one way or the other, and I think this is how we kind of segued into this back in the spring, was there was legislation was it to ban menthol cigarettes?
Yes.
So what was being proposed by the governor?
It was categorized as a means of stopping the use of menthol cigarettes for minorities, from the perspective that meant that minorities were driven to use menthol cigarettes. Marketing was taking them there, and it disproportionately impacted minority communities. So anything to do with smoking is bad for us all. And so I am dead against that. Anything that perpetuates tobacco use, marijuana use, that puts it forward, allows people to participate in this, especially where children are involved, that has to be stopped.
So what happened with the legislation on the menthol? Was that part, it was part of these, this is what I hate about New York State, well, one of the things, is usually they include in budget policy versus a straight up or down vote where you're allowed to vote on a specific issue. They're part of the major budget. So was the menthol ban put in place?
I am unsure because of the bundling, if it was or not.
Okay. So
it should be,
should be banned.
Yeah.
So, so when it comes to legislation, I'll get to vaping and I want to talk about some gateways in this in a second, is what role can New York State play when it comes to tobacco? Because I would still tell you 12% for a state average. And we can say that there's a large immigration population in New York City, that many of them come from countries where smoking, those numbers are much higher.
Right.
And but we are in a different time period. When you see 20% up in upstate, something's wrong.
That's right. One in every 20 middle school students, for example, reported in 2020 that they used e-cigarettes in the last several weeks.
So on the e-cigarettes? So this is vaping. Is there an age requirement? Does state law say, like cigarettes, you can't buy? I think it's higher now than it was. It's 21. It was 18.
Yep. In 2019, it increased to 21 to purchase tobacco products, including e-cigarettes.
And do we? Oh, so it does include that.
Correct.
So did we see a deterrent factor?
We did actually. I have a nice little graph here. So from 2014 to 2018, we had a 160% increase in tobacco use among youth. When that Tobacco 21 policy went into effect, we actually have seen a downward trend since then. In 2020, the FDA also banned flavored electronic cigarette products. We'll talk a little bit about some challenges we have with that.
Well, I have a couple of questions on that. So,
Yep. We've seen a downward trend with that. One of the biggest challenges is there's a lot of loopholes with us. We, as a county health department, enforce the Adolescent Tobacco Use Prevention Act law, which is the Tobacco 21 and the vaping products.
So are you sending out, I know there was a big story maybe a year ago near our Fulton campus, not at our Fulton campus, let me make that clear, but in one of the townships there, the superintendent found, I believe one of his children somebody tried to sell them flavored vaping, and he contacted the local law enforcement, and they raided the place and they shut it down. Is that something that your office and the county health is responsible for? Is that the sheriff's department, or is that state troopers?
It's a combination. We do enforce it here locally. It depends on the situation and where we get to. There's many loopholes because there's the FDA, there's the state law, and then there's the local law. So we are looking at the county level of ways we can increase or strengthen it so that we can enforce it because of the loopholes. So right now we're finding these places, and I think you've probably seen over the course of the past year that some of these vape shops are selling illegal products, the flavored products.
And do we have any idea how many vape shops are in Cuyahoga County? Because they seem to be on, when we used to joke that there was a church and a bar on every corner, it seems like there's a smoke shop or somebody who wants to get a marijuana license, which we can talk about later. But do we have any idea how many there are?
We do. They are required to register with us.
Do we have a numbers?
I actually didn't bring that with me today, but I can get that for you.
So as I was writing the questions, I don't smoke. I had a great teacher. I was a babysitter when I was 5 years old. Was at Lewis's restaurant. She was a smoker. Said, try it. Never picked it up ever again because I think I choked. But one of the questions I had was, I keep hearing about these flavored vapes. Do they taste like cherry or strawberry? What do they taste like?
I've never had one. However, talking with youth, they do. They 100%
So they're
do.
like candy,
They do.
and that then goes to the addiction.
Correct.
And is the feeling that if you start going with vaping, that you're going to graduate to cigarettes?
There's potential. I think that's the industry's manipulation. That's the industry's thought that they want to get a young generation hooked. You know, youth start using these because they think the marketing, that they're water-based. There's just nicotine in them. They don't realize all the chemicals. They don't realize the addiction level of nicotine.
So they are very addictive.
Oh, 100%.
Okay.
Anything with nicotine is what's keeping you addicted. The other drugs and chemicals are what's causing the disease.
And maybe the state's seeing these numbers, but for either of you, when they're starting that young, I know we're going to get to more, what I'll call more senior problems for people over time. They've been smoking 40 years. But are we having, whether it's asthma or other issues with young people once they take up cigarettes, that then becomes a burden on the state, either through one of the health programs or becomes a burden to the county?
Do you want to go?
Either one of you.
So it's unmistakable that there's a negative correlation with the use of these products. No matter what, there's no outcome that's positive. Kids get hooked, as was just said. They get hooked on one, they go to the other. And I watch, I'm very observant. I've watched people vape and vape and vape, and they don't get enough of that, so then they go outside and they smoke.
Right.
And they smoke cigarettes. And the bottom line at the end of the day is every single thing that we can do to prevent this is the right thing to do. Everything then that we can do to stop it and mitigate for people that are already exposed, perhaps already addicted, is the next best thing to do. And we live in a country that loses 480,000 people a year to tobacco disease. 480,000 people. On average, we live, those that smoke live 10 years shorter than those that don't. That's a decade of your life. That's the difference between dying at 72 and 82. So everything that we can do from a personal perspective for personal health, for inducing good habits in children, changing bad habits in adults, I think is the right thing to do. And unmistakably, it will save money within the healthcare system. When you look at the cost of Medicaid, those that are hooked on these products, what it costs us to a Medicaid family and or a Medicare family in both cases.
Continue on. So I want to ask this question. So when you look at vaping, well, finish it. You were going to add something to the overall question about that.
No, I agree, definitely. We know that, if you're young and you're using vape products, it's definitely a gateway to other drugs as well. It's just a continuation.
Well, so I was going to ask that. So is that the other public health issue here, that it's not only, I'm not minimizing it because I'm anti-cigarette. Besides cigarettes, is the next worry going that they're doing some type of other drug, and I know, and I'm not joking about this, unfortunately, there's a lot of discussion about legalizing and permitting, which I know the state's behind, and I know you don't support that.
I do not.
But the state is licensing. Are we looking at that the next group is now going from vaping and maybe even skipping cigarettes to marijuana and or other drugs?
I think that's always the worry, and you're always worried about, the fact that these are illegal products being sold and getting in the hands of youth, and what is the regulations behind them? What is in this product? It's not regulated. We don't know what they are inhaling.
So this is not a state issue. So the FDA does not regulate.
The FDA does. So
it does.
The problem is
for those that register with them.
Correct. So they have to prove different components, and then the FDA deems them that they can sell them. So as of March of this year, only 23 tobacco-flavored electronic nicotine delivery products have been approved.
Okay.
So if you go into a vape shop, have you been?
So I want to give you So I want to give you two different examples.
Yep.
So you both are here. You drove here, and around the corner is Speedway. So if I go into Speedway, I know they have tobacco products, they have chew, but I assume they have vape products.
Yep.
I'm assuming somebody like Speedway is only sticking with those 23 or less.
We would love to assume that, right?
Okay, so let's not assume that. So what does the county do on that front?
We will go in, our environmental health staff will evaluate it. If they are not, we will implement whatever we need to do. There is, I guess, a scoring system is the best way to describe it at this level. We will try to find them. I think you've read in the Citizen about how some of these places, it's mainly vape shops, some of our fines are in the hundreds of thousands. And then they'll close down, they'll open up in a different name and reopen. It's just these loopholes that keep
So is
happening.
it because of what they're selling, or on other occasions, is it like when you do alcohol raids, that somebody's selling something to somebody who's 18?
Yeah, so it's a combination of both.
Okay.
Yeah.
So if I walk, I have never. So I will say I have never had the reason to walk into a vape shop.
Yeah.
Though I do, I will say I think there are an enormous number of them.
Mm-hmm.
They all have signs. Many, not all of them.
Yeah.
Many have signs for CBD. It's all over the place. So how do you? I'm assuming the bigger problem is not the gas station that's owned by a national corporation or a regional corporation. It's more these individual vape shops, correct?
Correct, yes. So there's ways that we can look at that. Seasonally illegal products, a lot of times you go in and there's a menu to choose from, so the product's not even there. Ensuring that, if we have an issue with that specific retailer because they are selling to minors or they're selling illegal products, maybe there's some type of sign on the door saying, we have found these issues with this retailer. There's many different ways, so we're looking at
But I
those.
want to go back to the menu part here, because
Yeah.
this sounds like McDonald's. So you go in there, can you buy the product right there, or do you have to come back for it because they
Oh,
have to
no.
order it?
It's right there, but it's in the back room.
Oh, so you're relying on a clerk to go back.
Correct.
It's not displayed out there.
Correct, yes. And it's all the flavored products that are illegal.
So we weren't going to get into marijuana, but we might as well, because cannabis is, the governor and her team are under enormous criticism by many, for those who support cannabis, not those who are against. For those who are supporting and saying about the rollout. Is there the thought that many of those who want to be licensed are also vape shops as well, or are they separate?
I think the two go together.
Okay.
I haven't been in very many, to be honest with
Okay.
you. Intentionally, it's not something I would frequent. And I think as time goes, we'll see more of this together. And I would personally, back to your point on the rollout was horrible. None of the timelines were met. It left.
They're still not met.
They're not. And that left, for example, the farmers that were induced to grow it with product that they couldn't move because the state missed its deadlines and the state didn't the state didn't do anything that the original passage, the original bill that passed said it would do. And this is so patently irresponsible to introduce a drug that we know is bad. It's the #1 gateway drug to everything else that's bad. And one of the leading indicators is the highest risk factor for opioid abuse in adolescents is only having ever used marijuana once.
So when it comes to these licensures, will they be? I know the state will give the licenses, but will the county be the one regulating it?
As of right now, everything is regulated out of the Office of Cannabis Management.
Besides leaving this subject of vape, what is Drop the Vape? I know that's a campaign you're working on.
It is. So it's a national campaign that was started a few years ago because of the vaping epidemic that was occurring, I should say. Parents are struggling, school administrators, the community as a whole, and what do? These kids are now addicted. So the Truth Initiative, which is a national campaign, created a quit process that can assist 13 to 24-year-old individuals who are addicted or maybe just are questioning using
13-year-olds.
vapes. 13-year-olds, all the way down to 13, yep. Parents can call as well. So you can just text Ditch Vape to 88709, and you can start that
We'll
communication
ask you
line.
for that number again. So the reason I asked this is because we had Superintendent Jeff Parazola here the other day, and one of the
He's
questions
great.
for him was about the increasing numbers, I think it's 200 deaths a year, of fentanyl in high schools now, which is, all right, let's move on from vape. So the original discussion you and I had was Surgeon General comes out with this report in 1964.
Yeah.
Half the public didn't believe it. Those that did believe it wanted to sue over it because they had tobacco stocks. I'm joking, but
Right.
a lot of people did. 20% in Cuyahoga County, 12% in New York. How can we have not made more headway in 59 years?
I think there's a lot to that. I think, one, those products are still glamorized. Two, when kids grow up, they're exposed to their own family members that use these products. I myself, both of my parents died of tobacco diseases. Both of them, World War II generation. And I was thinking in reviewing for this, wouldn't it have been nice to have them both around for 10 years longer? And, but that wasn't in the cards for that generation. And then we peel it back and look at, well, what made them do that? There was immense social pressure to be a smoker. And I look at old family photos, and you're hard pressed to find one where all of the adults aren't smoking at every gathering. And so all of this lends itself to children see their parents, role models, and mentors smoking, so they think it's okay. They become smokers, and it just perpetuates itself. And so I think what we have to do is everything that we can to educate children not to do this, and as I said previously, do everything we can to get adults to understand as they're walking around with a cigarette. Thank God it's limited to almost only outside use now. You know, that's a whole nother issue. Thank God that children today do not have the exposure that you and I did.
Right. But some progress has been made. You were very clear.
Yeah.
You were nice enough to email me some information,
Yeah.
and you said the glass is not necessarily, in Guy's view, half full, dirty, leaking, and cracked. There has been some good news.
Yes, definitely. You know, we could still be at 28%, which, you know, we were there 15-ish years ago. We have clean indoor air. We have clean outdoor air. We have parks that are tobacco-free. We have, we can go to amphitheaters that are tobacco-free. The state fair is mainly smoke-free. We have.
What do you mean mainly?
Well, I think there's smoking areas
Like
where you
huts?
can go to.
Really?
Patios.
Yeah.
Smoking patio,
Yep.
I saw
Okay.
in the exhibition center.
Yeah.
Okay.
And the same thing with like the amphitheater in Syracuse.
Take your kids.
So, you know.
That was sarcasm, by the way.
I know.
Of course.
We knew. We knew. You know, so we're making headway. You know, we've come so far since that first Surgeon General's report. Probably you guys remember smoking in restaurants or the doctor's office. And now, can you imagine
Well, I will tell you, when I
someone
was
lighting up
developing
there?
these questions, I was thinking about as a kid, where
Yeah.
you would go into a restaurant like Ricky's restaurant or something else.
Yeah.
There'd be a machine there. Forget
Yes.
a
Oh,
human
yeah.
being.
Yep.
And
Vending
I don't know
machine,
what
yeah.
was the funner part, going to get the, I was fortunate my parents did not smoke, but my aunts and uncles did. I don't know what was funner, using the cigarette machine to get the cigarettes for them, which again, isn't a 7-year-old, most likely not a good idea, or the matches
Yeah.
that
Oh,
you
yeah.
get out of the
Oh.
machine too.
Yep.
Right.
So with that being said, from the county perspective, I'd like to turn to the state, but
Yeah.
from the county perspective, what still needs to be done, whether it's legislation or funding, or what can we do to bring that 20% down?
I think it's multifold. I think going back to figuring out the components of a TUPA and making sure that we're restricting access to youth so that the retailers are not selling illegal products. that they're not getting in the hands of youth to purchase, supporting those that are quitting. We need to do a better job. We know that the highest percentage of users are those that are disabled, of low income, less educated, are communities that need us the most, that have a lot of concerns already.
And have multiple health issues.
Yes, mental distress.
So, Assemblyman, what can the state do, though, that it hasn't done in your view?
Be responsible, number one.
How about just an out-and-out ban? I guess my question, we're 60 years.
That's what I'd like to see.
Okay, so what's the interest besides revenue?
Mm-hmm.
And I don't think revenue, I'm assuming from tobacco taxes, does not outpace public health costs.
I'm sure it doesn't.
No,
Okay.
it doesn't.
So why isn't that a discussion?
That's a great question. When you look at, for example, I think it's commonly accepted that cigarette smoking causes generally 16 types of cancers, and the notion that smoking marijuana doesn't, and that's okay, that doesn't make sense. And here we're advocating the use of marijuana in this state, smoking, and it doesn't make sense to induce that behavior in any way, shape, or form.
So I ask about this issue of ban, because obviously alcohol bans in the 1920s and 30s did not work well for a variety of reasons. But is the worry, besides the loss of revenue, that you're still going to have black markets out there? You're still going to have Native Americans who are selling in Cuyahoga County, selling.
Yeah. Or Onondaga for that matter. I'm sure that is part of it. And I wouldn't say ban. I don't say that lightly. I mean, it's a terrible dilemma to think of having to restrict your population from an adult's choice. They choose to do that. They want to do that. They understand. There's no way that you can't understand the harm that causes now. But when you look at, a minute ago I cited 480,000 preventable deaths a year. Of that 480,000, 41,000 of those are from secondhand smoke. So just think about that. In home, socioeconomically, as you just mentioned, the lower you are on the economic spectrum, the higher the incidence of smoking is and tobacco use, and that directly correlates to, I think, where you were going with what does it cost us at the state level and the federal level for Medicare and Medicaid. And
do we know?
We do. We do. It's in the billions.
It is, yeah.
9.9% of Medicare spending, $57 billion from smoking-related illnesses, and then it's $68 billion for Medicaid.
In New York State alone, the tax burden is about $1,500 annually per household.
Per household.
Mm-hmm.
So I want you to come back, because this is an important topic, and we should not have done it so many years ago when you were last on here, and we shouldn't just have it as a side conversation when you and I are chit-chatting during an interview. But we'd love to have you come. But before we go, I do want you to, if you could give that phone number out again.
Yeah, sure. We have the New York State Smokers Quit line as well, so that's...
Why don't you give both?
Okay, 1-866-NY-QUITS, and the New York State Smokers Quit line website is nysmokefree.com. For Drop the Vape, you can text Ditch Vape to 88709. And one more plug for the Upstate Poison Center. We know vaping products get in the hands of little kids and pets. They are a great resource if you think someone has been poisoned by the liquid or some of the chemicals within there. So 1-800-222-122.
Could you give the quits number again?
Sure, 1-866-NY-QUITS.
Okay. We want to thank Assemblyman John Lemondes for coming and also suggesting this topic. We ask people to suggest topics. You did it right here, so we appreciate this. We need to continue this discussion. Deb Pickering, who is with Cuyahoga County Health, congratulations on your new job.
Thank you.
Welcome aboard. But we'd like to have you both in the studio to have this and other public health topics as well.
Perfect.
We will be back on Tuesday with another Inside Government, our final Inside Government for the fall 2023 season here at Cuyahoga with City Manager Jeff Dygert. And then we're going to have another discussion, this one on the homeless shelter that is being built on Grand Ave. Elaine Daly, a member of the Cuyahoga County Legislature, Renee Jensen of the city, and Chris Trevisani will be in here to talk about that project as well. You can always send us your ideas for questions for any of those guests to cozguytho@aol.com. I'm Guy Cosentino for Cuyahoga Community College. I want to thank you for watching. Have a great weekend, and we'll see you back here in the studio for our final shows on Tuesday.